Hello everyone, I am Jayanti, audiologist and speech therapist. Today we will be talking about noise-induced hearing loss. So what is noise-induced hearing loss? Hearing loss which is occurring due to long-term exposure to loud sounds is called as noise-induced hearing loss. So this hearing loss is the second most common sensorineural hearing loss next to presbycusis, which is the age-related problem. There are two types of hearing loss due to the exposure to loud sounds. The first one is a temporary threshold shift where the impairment is for a temporary time. The second one is a permanent threshold shift where the problem is for a permanent. Permanent threshold shift has divided into two types. So the first one is the acoustic trauma. So this happens when there is a single episode of loud sounds, so like a burst of crackers, due to which there is a hearing loss. The second one is a noise-induced hearing loss. So this happens due to the exposure to loud sounds. And here we have two types. One is socioacusis, which is because you get exposed to loud sounds. So when you get exposed to loud sounds, as in pubs or in the gyms, so this becomes the socioacusis. And you have a different type of noise-induced hearing loss. This is during the workplace, where it is an occupational noise-induced hearing loss. So when we talk about the exposure to loud sounds, what is the loud sound we talk about? So anybody getting exposed to 85 decibels 8 hours a day for few weeks to few months would cause this hearing loss. The hearing loss is usually progressive from 1 to 5 years, and the person with this hearing loss would find difficulty in understanding people in a background noise situation, lack of clarity in people's speech, and he will have difficulty in understanding high-pitched sounds such as women and children's voices. The diagnosis for noise-induced hearing loss usually takes a longer time until the patient volunteers himself for the hearing test. So when we do the hearing test, we usually see a dip at around 4 to 6 kilohertz, and this is an irreversible loss. So the treatment for this type of hearing loss is to use earplugs. So usage of earplugs, you have a standard earplugs and the customized earplugs. So using this earplugs, there is an attenuation of noise from 15 to 30 decibels, and this helps them to lead a better life. Precautionary steps to be taken care of: listen to the music at a comfortable level, do not get exposed to loud volume, do not use headphones at a louder volume. Thank you for watching this video.